that's within her scope of practice versus, oh no, this is something well beyond the scope of practice for CLS. So they need to see an IBCLC, and maybe an IBCLC who has some experience in cradle sacral work because of the problem that their family is presenting with. So put it in the chat if I missed anything. I saw Brenda's go up, and I know other people had chimed in. So are we on the right page? And so I guess we'll be able to report out in our minutes what actually the data that we collected on that little survey that we just did. So thank you guys for working with us.
Absolutely. Glendine, report out for your group.
All right, so our group was looking at the work groups, work goals related to increasing education and awareness out in the community and among provider groups, et cetera. And one of the initial strategies that was listed was family medical leave, helping to ensure that paid family medical leave was enacted in Illinois. And so we had a discussion about what is the likelihood that our group could have any major impact in getting such a law put into place in Illinois. And the payout piece of it, is there availability of funds to even support such a law. But what it boiled down to is that the group felt that it was an important strategy, but it was probably one best left to those groups that are already working on it, advocacy groups, et cetera. The group identified several exterior community and um, agency groups that they feel are working on it, and we felt like we could, voice our verbal support of getting activity around that, getting legislative support, et cetera. But that would probably be the extent of what we could do. So it didn't come down to being one of our top two priorities. We also looked at that another one that initially was listed as a top priority or suggested top priority, which was the development and rollout of a statewide resource directory. And again, we had the discussion about what is our limitation as a chest and breastfeeding equity group in getting something like that going. There is a portion of that sentence, though, that refers to it talks about building a statewide directory, and then it's and or, and talks about the activity of finding out what does currently exist within each region or within each community that perhaps the breastfeeding people could link with and be a part of that resource network that exists. And they did feel that was very doable, and they actually did want to keep that as one of the top two priorities. So we ran out of time in terms of discussing what the second highest priority would be, but we had like a half a minute of opportunity to say yes, that the other strategies that currently are listed, several of them all tie back to having a unified comprehensive education plan around breast and chest feeding that we would be disseminating and teaching, training external groups around. So if we stuck with our current list of strategies, that would probably be our second priority, is to in 2026 put more attention into developing that unified plan.
Thank you both. So what we can do is turn what we've talked about here into a written document so that people can take it in, present it back at our next meeting. I imagine we might have a little bit further discussion as we look at what both groups came up with. And we will be meeting in, early 2024, January or early Feb. And then we'll have our plan of focus for 2026. So stay tuned for a write-up of what was discussed so we can just firm it up and have common understanding between all of us. With that, we actually just have 13 minutes left. Time goes quick, so I'm going to keep us moving along because we got a couple more big items to touch on. Next slide, please. We now want to touch on our 2026 legislative agenda as a coalition. So we're preparing for the next legislative discussion. So here and now, we're at the point in our year where we need to know what's on the table, what's under consideration. What are you all thinking of spearheading in your organizations legislatively? And then we can determine like what, if any, role there is for a coalition to have, certain things, a limited number of things IAPO may lead, and then we support member-led initiatives that are aligned with our agenda and the goals of this work group. So with that, if you could go to the next slide. We're going to talk about the two things that we've heard about already, and then I want to hear briefly if there's items you all are thinking of. So in the past, for the last couple of years, I think our coalition is supportive of paid family leave legislation. There were a couple of basically pieces of legislation out there that didn't really go anywhere last year. We have the continuing kind of serious budget situation in our state, but we can, determine is everyone still supportive of if there are member-focused family leave measures out there, that we would at least be looking at what those bills said and are, generally supportive of keeping this as an item that, our coalition wants to see advance. Does anyone not want to have concerns with keeping general support of paid family leave on our coalition agenda? Please weigh in the chat or unmute if you have concerns with keeping it.
So Sarah, given what the breakout group talked about in regard to paid family leave, would we still see that as a priority?
I'm sorry, I'm sorry, maybe I missed it. You were talking about that is less of a priority on your strategy list now.
Yeah.
Okay. So maybe not. No, not if that's what you all came up with. Okay, so group actually, maybe I'll loop back with you, Glendine, and just talk a little bit more about that discussion. But okay, noting that you actually unescalated that. Brenda, you have your hand raised.
Thank you, Sarah. I just had a question. Is this new to your advocacy agenda, or is this something that's being considered as an idea? I was just curious.
It is not new to the agenda. It was on last year's agenda, at least last year. I'm not sure about other years. We didn't lead anything. The coalition was supportive and monitoring any other entity that was moving something forward on paid family leave, and there were a number of proposals, but they didn't go anywhere. So it's not new.
Uh, okay. And that's okay, great. Thank you, Sarah. And then my other question, follow-up question to that is, who are the partners in the state of Illinois or nationally that we're collaborating with on our Illinois paid leave agenda?
I am going to have to brush up on that and get back to you. So I'm not going to be able to answer that here and now. I have to double check I knew there were a number of proposals last year that we were generally supportive of. So let me get back to you. Shelley, you had your hand raised?
Yeah, I think I was just obviously this is very important. So it seems like with the list of 7 things, like I'm not sure how much I'm curious what the actions would be from this group, how much time and energy and effort versus just advocating and putting your name out there as a supporter of this concept or something. I mean, obviously
I'm so glad you
we
asked. If you can go to the next slide real quick, Elise, and we'll come back to this. So IAPO, we do have limited staff capacity. So we tend to have a very finite list of things we lead, and we'll have very specific reasons for doing that. Paid family leave fell into the category of we're supportive of it where other partners are doing it. And so if it's us, we led things in the past around like school meals, for example. And if we're doing that, we're very involved. We're helping find, we're developing, we're first of all like using our paid lobbyists to move a piece of legislation forward. We might be drafting that. We're meeting with lawmakers. We're finding advocates to sponsor. Very involved, doing sending out action alerts. But that again is a very specific list of things. More fall into the our members are leading it category, and we are supportive. And what we're doing there is we are signing on to action alerts. We're helping blast out other people's alerts. We are taking actions ourselves to, register support. We are signing, putting in witness slips, or maybe putting our name on something. Most of it is that. So if you can go back to the other slide, I hope that helps answer it. But those are the ways we're generally being involved. And so we also evaluate. And what we're going to do is this. Right now, we're coming up with the list that we want our leadership committee to be considering and having on their agenda. And so if we keep paid family leave on there, it'd be, we like last year remain supportive of this. IAPOH supporting it, like supporting something that partners might put forward. And so in January, our leadership committee is going to look at the list and firm up with a wider context of, yes, what do we have the time, energy, and what is appropriate for us to lead? What makes sense? And what are we supporting? So right now we're getting the list together and we're going to flesh out further, like how does IAPO fit in? But majority of it will be supporting things. I want to, for time, quickly let Joanne speak to this universal newborn supports. Or I'm sorry, Glendine.
I was going to say, I
You
think
know
it's
I keep
actually
doing that. It's
me.
Friday. Glendine will do it.
All right. Yes, today is definitely a Friday. So I worked on the Early Childhood Comprehensive Systems grant for 3 years. I just stopped working on it July 1st of this year due to lack of funding in the grant for this last year for me. But so I'm just going to give you an update of where it is. The Early Childhood Comprehensive Service Grant, the federal grant, is what's driving the universal newborn support work in Illinois. The last 3 years, committees have been meeting to put together a framework as far as, for lack of a better word, what model might drive a universal newborn support system in a community in Illinois. We're looking at how such a project statewide could be funded. Where is the money going to come from? Looking at the content of care and the workforce that is needed to implement that. So, as a result of three different work groups paying attention to specific areas of what I just verbalized, there now is a process underway where the final recommendations from each of the three work groups are being put into a report that also includes the historical acquisition of the grant and what the intended work was going to be, what happened in the last 3 years, and what are the recommendations now in terms of one, where is that if the state decides to move forward and implement a statewide universal newborn system, what current um, administrative group or body in Illinois is going to oversee that work? Who is going to fund it? Is it going to be funded, through Medicaid billing? Is it going to be funded through using general revenue money? How is it going to, where's the money coming from to support it? What is the workforce going to look like? Is it going to be adoption of models that support only nurse visits, or is it going to be more of a adoption of the ability to use a hybrid model of staffing that would include maybe some nurses, but could also include lactation counselors, doulas, midwives, etc. And again, how are they going to be paid? What's that billing system going to look like? What are the expectations in terms of the content of service delivery, the timing of service delivery, et cetera? So there's a process underway to put all of that together into a recommendation report, which then will be submitted to a group of individuals at IDHS who have been identified as the reviewers and the decision makers in terms of where all of this goes. This is the last year of the funded money that the state of Illinois got. It will end on June 30th of next year. And so at that time, all activity would cease unless there is a decision to move forward and identification of answers to all of those questions. So right now it's still up in the air. We're very hopeful, those of us that have worked on it as well as others, that a decision will be made to um, put into effect a universal system of newborn supports in Illinois, but much more still to come in terms of if, when, how, and where that's going to occur.
Thank you. So I know that Start Early, our partners at Start Early are watching this. They're looking at that at the step where this becomes codified in the law. But Glendine, I know you were sharing that it seems like we're still a while out from that phase of the process.
Right.
Okay.
Yeah, and I understand where Start Early is coming from in terms of timing because, as I said, the current money is going to run out June 30th of 2026. So, in order to get, if the recommendation is that we do adopt a UNSS system in Illinois, in order to have funding for it, that would have to be part of the spring legislative session. And so, yeah, so that's got to happen pretty quickly if that's going to be moved through that session.
Thank you. All right, Elise, if you could go a couple slides ahead or go ahead, please. And one more. Okay, so I know we're now in our final minute. So what I'm going to do is I'm going to put out another call by email if anyone else has on their radar for the legislative agenda, and report back to you on that discussion. But I just want to put out a plug. We have these excellent co-chairs in place, but we do have a system of terms. So we are now in a new term for our co-chairs. So our how we do co-chairs for work groups is one community-based focused person and one statewide chair. And the chairs help create these meeting agendas, help identify speakers, co-facilitate meetings. They have that heavy staff support from me or an IPHI staff person. So we're going to send out the survey by email as part of our next steps that if you're interested in being a chair, need to have you fill out this brief survey by December 12th. I know we're going to have you share out, Glendine and Joe, but we are now out of time. So we are going to move ahead. I'm going to close us for that purpose, but look out for that survey. Look out for the write-up of what we've accomplished in our meetings. And then we will next be meeting in January, February of next year. So appreciate you all for a very productive discussion and thank you. Have a good rest of your day.